Generally, the first point of contact with a pregnant woman would be when she discovers she's pregnant. The woman would contact her GP practice, and the GP practice would put her in touch with a midwife appointment for a booking. We'll ask the woman a series of questions. We're asking about her family history, her own medical history. We ask her when her last period was, if it was a planned pregnancy. The next phase would be we do more of a detailed history taking, and that can take up to about an hour. That's usually done in the woman's home, but things are changing, so it might happen in the hospital setting or a health centre setting. We talk about everything from their general health right through to their fears, their anxieties, get them in touch with different people if they need to be in touch with different people, to other professionals. A lot of women are very excited to be pregnant, and they're also gearing up for the labour and the baby coming. But we have to sort of bring them back a little bit and talk about what foods are good for you, all the health implications of being pregnant and how they can help themselves in the pregnancy.
The Down syndrome screening takes place at the first appointment here at the hospital. This is a screening that's offered to all women roughly between the stage of 11 and 14 weeks in the pregnancy. What we're doing by a variety of factors is saying, this is your chance of this baby in this pregnancy having Down syndrome. It looks at your scan measurements. It looks at the crown rump length of your baby on scan, which equates to how far on in your pregnancy you are. It looks at the nuchal translucency measurement. It combines that along with a blood test from yourself, 2 markers in your blood. And then the other factors are your age at delivery, your weight at the time of testing, whether you smoke or not, what your ethnic group is. So these factors are all taken into account to then say, this is the chances of your baby having Down syndrome. It gives the woman or the couple the choice, say, where are we going to go with this information? We will never tell any women what to do with the information. We will just give them it and they'll decide from there. The group that we offer follow-up is 1 in 150. So if the chances are greater than 1 in 150, we'll inform them of that result and give them the option of going for further testing.
The next process would be to come for a booking scan. The booking scans to date the pregnancy, see how many babies there are, make sure there's only 1 or 2, make sure there's a heartbeat, look for any structural abnormalities that might be there at 12 weeks. I think people perceive that it's a nice scan, that they're going to see their baby and they're going to be able to get the sex of the baby and get some nice photographs. I don't think in the big picture they realise that this is actually a screening test. So it's very important that they know it's not just a social scan. It's not always possible to sex the baby due to the position of the baby. We've got ultrasound equipment which, as the years have been going by, they're more and more advanced, so we're seeing more and more detail of the babies all the time. We'll be looking for any abnormalities with the face, head, heart, limbs, spine.
The scan report is passed over to us by the sonographer. Obviously we're explaining the due date that's been given from the measurements taken on the scan and explaining to the lady obviously her gestation at this point. We're checking the blood pressure. We'll have checked her urine sample, so we're looking for urine infections. We're also doing the lady's weight and management as far as her BMI, body mass index, is concerned. We're testing their blood groups, so we're looking for any potential problems should they have a negative blood group, rhesus negative blood group. We're also looking for any problems as far as anemia is concerned. If they've had any previous infections in their past medical history, that might have a bearing on how we're going to care for them during their pregnancy. We're looking to just make sure everything's normal, and obviously depending on what information the lady's been able to give us about her own medical history and her own background within her family history, is picking up any potential problems that may be ahead for her during her pregnancy. As best as possible, if someone's been cared for as a low risk patient, they won't come back into the hospital service, they'll be cared for by their community midwives out in the community. But the ladies who are deemed higher risk for whatever reason will be seen more regularly at the hospital, and depending on the reason they've been classed as at risk will determine the protocol that's followed there.